Hello. It's Mrs. Smith, isn't it? I believe your daughter got burnt last night. Can you tell me how it happened?
I was cooking dinner last night. I was busy, you know. I got distracted. I shouldn't have done it. I know I should have taken more care. The phone rang and I went out of the kitchen to answer it.
That's okay, take it slowly. I want to make sure I understand correctly. So you were cooking dinner last night and what happened then?
I was cooking rice and my daughter wanted to see what I was doing. She wanted to see how much rice I was cooking. That's when she tipped the hot water on herself. And then she burned herself.
I see. That must have been very frightening for you. And for your daughter.
It was awful. It happened so fast too.
Yes, it can happen very fast. Can you tell me what you did first, to do something about the burns?
All I could think of was to take my daughter's shirt off and soak it in cold water. I put the wet shirt over the burns on her arm. Did I do the right thing? I just did what I thought was right.
Yes, you did the right thing. People used to put butter on burns, but it's the worst thing you can do. You made the right choice.
But I feel so guilty. Look at her arms. She'll have terrible scars.
I know it looks awful now, but it will look a lot better when the burns start to heal. You must try not to feel guilty. Children at this age are very inquisitive. They just want to look at everything, but they don't realize the dangers. Scalds on the arms, especially the hands and fingers, are very common. And the scalds most often happen in the kitchen.
But I shouldn't have answered the phone. If only I had stayed in the kitchen. I don't know. I feel so bad.
I understand that you feel bad about the accident, but I think it's important to focus on what we are going to do now to treat the burns. Is that okay?
Oh yes. Sorry. What happens now? What are you going to do? She's in a lot of pain.
Yes, I know. So the first thing I'll do is to give her a small injection to help with the pain. When the pain is under control, I'm going to wash her arm very gently and put on some special cream. The cream will help stop any infection to the burned area. We also need to make sure she is drinking enough. Can you help with that?
Yes, sure. I'll give her sips of water whenever I can.
That's great.
I'm sorry, I don't think I took in what you said about the scarring. Can you tell me again, please?
Sure. It's a lot to take in. What I said was that it looks bad now because her skin is very red. It will look better once the skin starts to heal. Your daughter will need to have dressings to the burns when she goes home. I'll give you a follow-up appointment for the dressings clinic. They may arrange for a community nurse to come to your house after a few clinic visits.
Okay, that sounds okay, but I'm still worried about the scarring. Is there anything I can do about it?
After the burn has healed, the clinic will probably refer your daughter to a dermatologist. There are some very good treatments these days, so please try not to worry too much. I know it is difficult to remember everything, so you might find this brochure helpful. It has some advice on making your home as safe as possible to avoid accidents.
I see. Okay, well, that makes me feel a bit better. Thank you.
That's all right. Read through the brochure and ask us if you still have any questions. There is a contact number at the bottom of the brochure.